The more that I have learned about ergonomics, fascia, and how everything impacts the need for movement and how necessary that is, yes, I do know many hygienists who are in their 70s. So yes, it can happen. It's how we treat our body and train our body to hold us through those 8 hours a day. Absolutely.
I actually found that after a yoga class, my pain was either significantly reduced or gone after taking a yoga class. And the effects of the practice would last a few days. Of course, I also noticed that it relieved stress within me as well.
Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, episode number 236. My name is Andrew.
And this is Michelle. Happy July. How in the world is it July?
COVID happened and we were all hibernating for 3 months.
I saw a really great meme that sums up a lot of things for me. And it was like, in 2 days, June's going to be over, but I'm still mentally in February. And I was like, I've never read anything more true in my life.
Exactly.
It's bonkers crazy, but happy July, I guess. We've made it the second part of the year.
Yeah, that happened.
Yep, crazy. I was about to say something about intermission and be like, oh, and I just had intermission and I just watched Hamilton, which is like, I don't know. Do you know if Hamilton was because nobody was able to go see it, so Disney put it on?
Oh, you're asking the wrong person for that, for sure. But
in my mind, that's how that worked. And I'm just like, these are like my silver lining COVID thoughts. Like because COVID happened, now I got to see Hamilton because I've done the lottery for those tickets every single time I've gone to New York and I never got it. So I'm over the moon.
It's been
about it.
Like, well, even on their and I look, again, I'm not the expert on this, but I feel like their traveling people are like not like the main people that did do it in New York.
Yeah,
like
the original
understudy
ensemble.
Or whatever. And so like even then when they came to Portland and all that, I didn't bother going. I didn't even try to go. Plus I knew the tickets were going to be really hard to get. But now I saw it and it's like, oh, the great cast. And well, actually, I actually haven't finished it yet. I've only got to the intermission. I've only got to the first little half of it. So don't ruin it.
Well, I should ruin it for you for how horrible of a human you are.
Hold on. No. You have to also tell our friends, by the way, this is a dental podcast. We'll get to dentistry here in just a minute.
We will.
But no. You are a cheapskate and don't want to pay the $7.99 for Disney Plus. So let's start off with that story.
Okay, for one, who doesn't share passwords? Okay, the only thing I actually subscribe to is Hulu, and then 4 other people have my password, and I have everyone else's Netflix and all that. Like,
sure,
that's just the life we live right now, where no one really actually pays for these things. So when I heard that you had Disney Plus, and I think my text was, I'm gonna need that password.
Yeah, and of course, so like the password before was one that I used for other things. I'm like, yeah, okay, well, I don't really want her accessing all my bank accounts because I know how you like bleed us dry because you don't like us. And so I'm like, well, let me then change it to a password that is easy to remember.
Makes me a horrible human.
Something that I just know that you love. And yeah.
Okay. Besides this password being so obnoxious with all the words that I despise
there's at least 3 iterations of the word moist, which she hates. And Flappy was thrown in there too.
But in addition to you using such disgusting verbiage or words in this, it's like 49 characters long.
Yeah.
And to put that in a Roku remote is like, like Guantanamo Bay kind of torture. Like
I almost made it every other word or every other letter was a capital letter too, just to really.
I would have dissolved this business right now. And I see how much he hates me as a person. Weird.
Yeah.
Because I mean, this is 100% first world problems, and hilarious that this is what we are arguing about is like naming passwords to torture people and making it so long and ridiculous.
It was clever. It was clever and good. So
I don't know if that's how I would describe it, but something.
So as we transition into something completely different, can I just say I have listened to myself on a couple other podcasts recently. Ashley McCauley does Discovering DSOs on our
on the network,
Channel 1.
Mm-hmm.
Man, she does a great podcast. I just want to say, like, I hope her show sticks around for quite some time.
Everyone on the network does a really great job.
Yeah. I was just really impressed. Like the passion, the thought, and I don't know. I like it.
Well, Ashley's amazing. You know, we have really come across some amazing individuals in this profession because of the podcast, the one that you're listening to right now, and everyone's getting these great people they have their own podcast now. And it's so fantastic because they have such a great, like you said, a passion and a love that's contagious. And oh man, you just want to be around them all the time. Ashley's one of them. She's great.
Yeah, I absolutely agree. Also, I want to revisit a comment that I made on a previous show about the heat.
Of ours?
Yeah, on ours. About when I was like, everyone needs to quit being a bunch of babies, a bunch of wusses or whatever.
Are you
it's still
now
true.
in that category?
No, I mean, it's still true. So the only thing is, like, I've started wearing a hairnet now, but it's one of those breathable ones. And
bonnets.
Yeah, it's like, well, it's a disposable one. And so it goes all the way over. Anyways, I'm pulling it off. I look great in them, by the way. The other thing, though, too, is I'm wondering, because we do the KN95 masks, not the N95s, I might not have the full experience yet.
The N95s are rough. And I only wore it for a day. And South Carolina is a lovely little hot spot now. Everybody.
Michelle Strange, patient zero, spreading it around.
You know that's not true. I actually went to the beach yesterday for 4th of July. We're recording this on Sunday, the 5th. And I went to the private part of one of our beaches that you have to get past a gate, and we know people or whatever, because it wasn't going to be super crowded. And I mean, it was the epitome of social distancing out there. But I jumped in the car with a group to go past the gate. And I got in and I put a face mask on. They're like, why are you wearing a face mask? I was like, because I can't yell at people for being a part of the problem and not wear my face mask. It's like voting.
Yeah, exactly.
I have to vote so I can yell at
so you can complain about it
our
later.
Congressmen and our senators and our city councilmen. I have to yell at them. But it is rough. And so now that South Carolina is a hot spot, just a breeding ground for good old COVID, our clinic has been delayed to August.
Oh, buddy. That's killer.
I know. It sucks. I just feel bad for our community. Like we can't get these patients, but I mean, our clinic is a little bit special, so I get it, but stinks.
Yeah.
But on the flip side, I also see the horrible stories about the face mask and how hot and horrible it is and the headaches. And I'm just really glad I don't have to go through that. But at the same time, I'm like, I want to see patients.
Yeah.
I want to get back.
Well, just look on the bright side. It'll give you more time to do more podcasting. Hooray.
This is true. So true. I did get to go in and test some suctions, and I did get to go in and put in my new Zobi organizational box of efficiency into place, which is awesome. I was so happy to do that. So did I tell you about the box? I told you about the box, right?
Of course. I know about the things we do. I know I pretend like I don't.
Maybe there's the problem. Like you show zero interest in things I do. So I don't know if I actually tell you things. But so everyone, listeners, Zerk, who has been very kind to sponsor the podcast very early on, they have a box called the Zobi, which is Zerk's organizational box of efficiency. And it has all of their color coding things that you can implement into your practice. So I got this box and I had 3 long calls with sweet Brittany from Zerk, who was kind enough to spend extra time. I feel like extra time. Maybe everybody takes that much time, but I feel like I was asking way too many questions because our clinic is really special. I just feel like we have a lot of turnover, not turnover like because people are quitting, but because we have volunteers, we have residents, we have students, we have hygiene students, we have AGD dental students. We have like evening extraction clinics. We have all kinds of stuff happening out there. And so I just feel like our clinic is really hard to kind of nail down into like one color coded thing. Mm-hmm. But man, she really helped us like get it together. So I placed an order and I am getting our clinic color coded with the Zerk organizational setup. So I'm really, really excited. If you guys don't know what that's about, you can go to Zerk.com and you can order the Zobi box. It's free. It's like having a rep in a box is what I think they are also compare, but it's very true. Like you get everything that they have and then you call them and they kind of walk through it and you have the opportunity. So like if you have a composite setup, you put everything you possibly could need for the composite setup and kind of figure out like what you need and what you don't need. It was so fantastic and so easy. So I highly suggest you guys go check that out, Zerk.com. And so I'm very happy that my clinic has been kind of shut down so we could implement things like that. That would be a little harder if patients were there. We were doing our waterline testing. And that's the other thing. We did launch our docu-series for infection control 2 weeks ago. So you can go check out my call with Zerk on the Instagram TV and on our YouTube channel. You can see my waterline testing and shocking. So if you didn't do that before you started seeing patients, stop what you're doing right now. Don't see another patient without testing and shocking your water.
Seriously.
Ugh, so bad. I also tested our toilets.
I saw that. I wasn't sure if you're going to tease that during this part, but I'm like, oh man, that was good.
Tested our toilets. And because I've been saying in some of my lectures that I'm pretty sure we're flushing our toilets with cleaner water than what we're putting into people's mouths. And I was correct.
That's
and
gross.
That is horrible.
Very,
Ugh.
very gross.
So check out those docu-series. They're on our Instagram TV and our YouTube. And the other thing that I'm concerned about, you weren't present for this interview that I'm going to tease here, but we talked about ergonomics. This is the month of ergonomics, everyone. This is a topic that not many people talk about or go to so many courses because there's not all for CE. So people don't always attend them. And we develop a lot of bad habits that are hard to break unless you're really passionate and like encouraged to do it. And we were talking about in this podcast, sitting versus standing. Because Andrew stands.
And how standing is better is probably how this ends, right?
Not necessarily.
100%, you mean?
No.
Always better. Andrew's right.
You'll listen to the interview.
Check mark
you'll hear it.
Andrew's name.
You'll hear it. And are you still standing with all your stuff on?
Actually kind of both now.
Going back and forth.
Yeah, it's because I'm in different chairs. Anyways, we don't need to get into it, but I'm kind of hybrid now.
Well, I'm a hybrid now, I would say. I stand at certain, when I'm trying to reach certain spots in a patient's mouth, maybe some of the away surfaces I stand. And I've definitely, but even before COVID happened, started standing more because I was really trying to get better with my high volume evacuation.
Yes.
And I find the ergonomics when I stand to reach certain areas in the patient's mouth is way better on my wrist and my shoulder. And I was really excited to talk a little bit about those kind of things today with Tracy and Aubreé. And so Tracy wrote an article, and we're going to have these things in the show notes so that you can just click and read these articles. But I reached out to Tracy after I read an article about fascia that she had written, and I think it was RDH magazine. And I'm obsessed with fascia. I've been obsessed with fascia for a while. Andrew, how many years ago did I start bruising myself?
With a little flat fascia blaster or whatever that thing is called. It made its way to the podcast a few years ago. I'll just say that.
It's been a few years and I've been so excited about learning about fascia. I think it's an area that we don't talk about. And I think it is also what's going to, if we don't identify it and start doing something about it, it's going to hurt a lot of us in the long run from a career standpoint. So I really hope you guys enjoy this episode with Aubreé and Tracy, all about fascia, ergonomics, and some yoga.
Hey, Michelle.
Yeah.
It's time for the interview.
Oh, but I had something else to say.
We need to let the experts talk now.
Fine.
Listeners, thank you for coming back to another interview all about ergonomics for this series. It's a series and a segment of our industry that I don't think gets enough attention. So I'm really excited to have two guests on that are, we're going to start with ergonomics, but we're going to get into something called fascia. And when I read this article that was in, I believe it's RDH magazine, is that correct?
That's correct.
I was like, oh my gosh, I am so excited that people are talking fascia. Fascia, I am so obsessed with it. And if anybody has encountered me in the world, they know that I'm like obsessed with it. So I am so excited to welcome Aubreé and Tracy. Thank you for joining us.
Thanks for having us.
Thank you for having us.
So tell me a little bit about yourselves, and either one of you can go first.
I'm Aubreé Chismark, and I've been a registered dental hygienist for many years now. I worked in private practice for 10 years, went back to graduate school, and I've been teaching now for, it'll be 10 years in August.
That's awesome.
And then I'm Tracy Ross. I've been a hygienist since 2000. I'm sorry, for 20 years. I graduated in 1997. And I worked in private practice for about 17 of those years when I realized that my body hurt. And I didn't think that I could be a hygienist, into my retirement years. So I started looking for some different avenue of income. And then so I started teaching part-time in 2011, I believe. And now I'm full-time at West Coast University with Aubreé. And I teach a general pathology class and a medically compromised and emergency care class.
So you're bringing up such a good point that feeling that your body's not going to take you into retirement is a very, I think, common feeling and thought amongst a lot of dental practitioners. But would you say that that's always true? Like could your body take you into retirement?
Well, the more that I have learned about ergonomics, fascia, and how everything impacts the need for movement and how necessary that is, yes, I do know many hygienists who are in their 70s. So yes, it can happen. It's how we treat our body and train our body to hold us through those 8 hours a day. Absolutely.
Aubreé, what classes are you teaching? Are any of them on ergonomics?
I teach preclinical to the junior students, and I teach research methodology. And I incorporate ergonomics, of course, into the clinical setting and also into the laboratory setting. I also teach the students yoga stretches during lab sessions, during lecture sessions, and also during huddles before they have a clinical session.
That's great. So you guys really are practicing and teaching what you preach then.
Yes.
Yes. Aubreé has even done some original research on yoga incorporated with education and published her article. And I can't remember what magazine that was, Aubreé.
Yes, it's the Journal of Dental Hygiene.
Awesome. Well, check that out, listeners. So ergonomics, like when did you guys delve into that as a topic? Because I feel like you said if your body was starting to hurt, and that's when everybody then starts to look at ergonomics and what we've been doing. So when did you both dive into that?
Well, when I was in private practice, I was always aware of my posture, tried to maintain proper ergonomics. I did wear magnification loupes. Although one of the big issues I feel in private practice is that the operatories are not designed to be ergonomically correct. So we're having to adapt our positions to treat the patients without being able to get into the correct ergonomic posture.
For me, I always struggle. I'd like to say that I had good posture, and my students called me out all of the time for like crossing my legs and doing these things. But being what I found with private practice equipment was they were not designed for me being a tiny female. Is that common?
Yes. Yes, I think it's very common. And, even though we try to maintain proper ergonomics throughout the day, seeing at least 8 patients a day, the repetitive motion, all contributes to pain that dental professionals, dental hygienists experience.
And would you say that we all have very common chronic areas of pain?
Yes. The most common areas reported by dental hygienists specifically are in the neck, shoulder, back, wrist, hand, and forearm areas.
Which makes sense in that you pretty much named every part that hurts on me.
Yes.
After 20 years of this. Yeah. All makes sense. And RDH is how do we combat this?
Well, I feel that, of course, trying to maintain proper ergonomics, wearing magnification loops with lights, incorporating a saddle stool, if that's possible for you. If you're using a regular clinician chair, make sure that it's adjusted properly. Using lightweight hand pieces, even cordless, if that's an option, making sure that your instruments are sharp. All of those things helps to contribute to good ergonomics.
Which are things that we definitely learned in school, right? Like we knew that we needed to sharpen our instruments because obviously it makes us pinch the instrument a little bit harder, press into the tooth a little bit harder when it's dull. And the saddle stool, though, I'll be very honest, I just got one within the last year. I did not realize how awful my position was in a regular dental chair. And I say regular, quote unquote, regular, like the ones built, I think, ideally for male dentists, that I was forcing my little 5'3" frame to work on. And when I got into that saddle stool, like I finally sat up and I was like, oh, I feel like I can move. I feel like I can move around. I feel like it's not like I would almost always, and I noticed I stay in the same position to treat the patient and I wouldn't fluctuate. And then I would adapt my body because it took so much movement or effort to move the stool because it was just like, I'd have to like get into it. Like I have to dig in and like push myself off just to go to the 9 o'clock position or something like that. So that has honestly been the best thing that I ever did incorporate is the saddle stool.
Yes. When I was in private practice, I had a regular clinician chair and I did the same thing. I wanted my patients to be comfortable. So I compromised my ergonomics so that my patient was comfortable. And that was a huge learning lesson for me as well. And I share that with my students and encourage them, make sure you have the patient turn their head to one side or the other. Make sure they're lifting their chin. They're only in the chair for a short period of time. And so this doesn't compromise their bodies as much compared to ours throughout the day.
What are some very common incorrect ergonomic positions that we could maybe ask our fellow colleagues to identify for us?
I would definitely say leaning the head to one side or the other, bringing the chin too far forward, bringing the shoulders up toward the ears, and also bringing the torso forward too much. I would say another incorrect posture that I frequently see is the elbows being abducted away from the body more than 20 degrees.
Yeah, the good old chicken wing. Right?
Yes, exactly.
Get that chicken wing out there.
Yes.
And that's where all my shoulder pain is, in that left chicken wing shoulder.
Yes.
Years of that.
Even leaning to one side or the other. When I was working in private practice, I remember leaning toward my right side, which caused severe sciatica symptoms in my body.
What is sciatica exactly?
Sciatica, from what I have learned, is a symptom of something else that's going on in the spine. So it could be from a bulging disc or a herniated disc. And obviously that's something that would have to be diagnosed by a physician or a chiropractor. So usually it's a symptom from something going on in the spine.
That makes sense. I always joke because I did assisting and hygiene. And I was like, I feel like I'm pretty balanced because one day I was leaning one way for assisting. And the next I was leaning the other way for hygiene. And And I was like, thank God I can do both, because if I wasn't, and then I stopped, I went to full-time hygiene. I was like, oh, my poor right side. And just lean that way all day long. But I also found that my ergonomics got a little lax, maybe when I was not running on time. And there's so much to like taking care of yourself that's not just correct position, right?
Exactly. One way to take care of yourself is what you're doing outside of the dental setting, what you're doing in your spare time, but also incorporating some simple stretches in between patients can be very helpful. I remember the days when I was working in private practice and experiencing that chronic pain between patients. I would do some simple stretches that I could just do in my chair or while standing between patients because of the sciatica symptoms that I was having. I knew what stretches would help to relieve that pain, or just doing some simple neck stretches. Definitely, moving the body is helpful throughout the day, even though, yes, it is challenging because we have to stay on time for our patients, which creates, stress within us as well.
For sure. And a lot of us will forego lunch breaks and water and all kinds of stuff because we're trying to hustle and see how the patients stay on time.
Exactly.
So why did you incorporate yoga?
When I was living in San Francisco, at the time, I was having a hard time meeting people, and my mom suggested for me to try yoga because she said people who practice yoga are nice. And so she thought that would be a good way for me to meet people. So I started taking some yoga classes, and I actually found that after a yoga class, my pain was either significantly reduced or gone after taking a yoga class. And the effects of the practice would last a few days. Of course, I also noticed that it relieved stress within me as well.
Is that because yoga does a lot? Is it more the stretching with yoga, or is it more the stability core building?
I would say it's a combination of both the stretching and strengthening of the muscles in the body.
So with yoga, I can imagine just about any exercise would be good, but incorporating that stretching would be incredibly important, which I don't see many people do at my gym. They just show up and work out, lift weights, pick them up, put them down, and then leave. I'm like, y'all gonna hate your bodies after a while. Yoga is great. I love yoga, but I'm a yin yoga person. Those long, long stretches.
Yes, there's definitely benefits to any type of yoga practice, whether it's yin, more restorative type of yoga, vinyasa flow, can be a little bit more upbeat and strenuous. So I definitely highly recommend something that would be more therapeutic, such as a restorative class, especially if you don't have any previous yoga experience, and especially to help with reducing pain in specific areas of the body.
So do you suggest things like physical therapy and massage and chiropractic, or any other additional things to help with spot areas of discomfort?
Yes, if you're experiencing chronic pain, I feel it's definitely good to see a physician, see a chiropractor, see a physical therapist. There are great benefits to having a massage regularly. Dental hygienists have reported a reduction in pain even when having massages regularly. So I feel all of those complementary health approaches are beneficial. So I think it's a matter of finding what works for you. For me personally, yoga helps to reduce my pain significantly. Research also shows that yoga reduces pain significantly in the general population and even among dental hygiene students, because the pain actually starts while students are in school. Now, the thing is, in most dental hygiene curriculums, there is no ergonomic course that's implemented.
Yeah.
And so it's really a matter of the faculty encouraging and reinforcing ergonomics in the clinical setting and in the laboratory settings.
One of the things that I find too is like ergonomic classes and courses are not for CE credit for a lot of states, unfortunately. And so we forego those particular courses. But really, that's going to be what keeps us doing this even longer.
Yes, I think that's definitely an unfortunate thing. I have given some CE courses in the past with a colleague of ours where we implemented instrumentation, reinforcement techniques, and also emphasized the ergonomics and the yoga into those courses.
Because that's how you got to get around it, right?
Exactly.
But they all go together because, I mean, to, again, not have sharp instruments and good instrumentation, that will create some ergonomic issues for you and ultimately pain.
Yes, exactly.
So you feel like people are already seeing pain as dental students or dental hygiene students?
Yes. And where we teach, our students have everything to help them to be ergonomically correct. They have magnification loops with lights. We actually have saddle stools in our clinics, which is great. So I see the students in their junior year, and when they start working on each other in the student partner clinics, I get them accustomed to the saddle stools so that they can have the proper ergonomics to help reduce the pain while they're in school, to help, prevent the pain from occurring. I think once again, if the ergonomics isn't being reinforced during the clinical sessions, that's where one of the main problems lies, right? I can't be in every single clinical session with the students reinforcing the ergonomics. So it really takes everybody to help out in that way to encourage and reinforce it.
I always find with my students, I'll walk by, our setup is like, they got 10 units on one side, 10 on the other, or whatever it is. And I walk down the aisle, like checking in, and I can always see when they feel like they're being on a time crunch, like I got to get this patient done, or they need to leave, or I need to get a check or requirement or something checked off. And I see that's when their ergonomics just slowly start to decline, and they get that hunched over. And then they start doing things, and I'm guilty of this, like crossing their legs to get closer, or putting their feet on the casters. Is there any particular things that you see pretty routinely as one thing that will go as soon as like they're on a time crunch or stressed out or something?
Yes. Their neck or their head turned to one side or the other. And when I see this happening, I'll go over and correct the student, and they try to say, oh, it's just for this one area. I just need to see this one area for 1 minute. But they don't understand that over time, even if they do it for a very short period of time, that is going to eventually contribute to the pain.
For veteran clinicians, how hard is it to retrain yourself?
Well, I think it all comes from within the person and whether or not they're willing to make that change. I think that's very important. It has to come from within that person to want to make the change. So I think it's very possible. It's just a matter of being open-minded and trying these different tools to help. I think the hygienists who have been in private practice for over 30 years are the ones who are taking care of themselves. They're active. They have an active lifestyle outside of the dental setting. They're maintaining ergonomics. They're using all the tools in private practice to help them stay ergonomically correct. They are, making sure that their instruments are sharp. I think those are the hygienists or dental practitioners who are able to maintain long careers.
What would you say are some like keystone habits, like baby steps, as someone is going, okay, yeah, I'm doing this 20 years, 25 years, and I know my ergonomics suck because now I cross my legs, I do that head tilt over, I've just started to develop these things and my body hurts. I mean, is a baby step to go to yoga and get more active, or is the baby step maybe like in the practice and in the office?
I would say the first step that I've seen hygienists take would be purchasing a pair of loops. with the light.
If they don't, yeah. Mm-hmm.
I think that's a great first step. And then I think considering implementing a saddle stool, because that's even something that is going to take the body time to get used to.
100%. I'm going to tell you guys, it will feel like you rode a bicycle for 4 days on day one.
Yes. I had a student the other day, she used a saddle stool for the first time, and she said that she could feel it in her body as well. And so I told her, well, maybe next time we'll just have you use it for an hour and then use a regular clinician chair or even stand. Actually, standing and sitting, it's good to alternate those things because it takes pressure off of the lumbar spine when you're alternating. So if you're seeing at least 8 patients throughout the day, that is a good option as well. Maybe you're sitting for one patient and then the next patient you're standing.
You know, Andrew, who's not on the podcast today, he stands pretty routinely treating patients. And I have always sat, you know, historically. And we've always had this like contentious, like, which one's better? And what I've started to do, though, I'd say in the last 6 months, well, before COVID, of course, because now I'm going to have to even remember what here is mirror, here is scalar. I was starting to do maybe certain areas of the mouth sitting and then doing the other areas standing, because I visually and ergonomically could get my posture in a better place. And, you know, I've been a hygienist. Well, I've been in dentistry for 20 years. I'm like, how long has that been hygiene? 17 years or something like that. And I'm like, why did I just now catch on to standing as an option versus me having to like either the patient turn their head pretty much on their ear or me doing this weird position that obviously has created some pain in my body through the years. I'm like, well, lesson learned. So do you find that actually, maybe if it's not every other patient, maybe it's parts of the appointment that would work?
I think that's a great idea. Definitely a great idea.
Excellent. Well, and you know, the thing about the light that I guess thinking about it, I'm like, obviously, but it's that repetitive overhead motion and movement. And I was like, I'm surprised that I didn't damage my rotator cuff or something, like yanking it and moving it all around, especially some of the ones that are not like easy gliders. And man, when I got that light on my head, I joke all the time, I'd give up my loops before I give up my light.
Yes. The light on the loops is so beneficial. When I'm in the clinical setting working with the students, I use my loop light. I don't even use the overhead light anymore.
Never. Yeah.
Although if there are hygienists out there that are still using the overhead light, it's important to try to keep it within arm's reach to help prevent any pain or injuries from occurring.
That's smart. And is there any other like little tidbits before we start talking about this layer called fascia that we don't really consider in dentistry I won't get out. I'll let you sell it to everybody.
Okay. Well, I think just being aware of your body, being mindful of how you're sitting while you're seeing patients, trying to incorporate as many ergonomic items as you can into the clinical setting, whether it's, wearing the loops with the light, a saddle stool, making sure your instruments are sharp, using a lightweight handpiece. All of those things can help you to increase your career longevity.
There's one thing that I think we're about to hear a lot of comments and complaints and concerns around, and that is going to be the new, or even though this should have been something we were all doing, but high volume evacuation. As a solo practitioner, I did not learn on that. I was not trained to use that in school, whatever years ago, 15 years ago, 16 years ago. And I just started doing it about almost 2 years ago. And I will tell you that was difficult. And my ergonomics definitely suffered for a little bit.
Yes. Thankfully, where we teach, our students use a high volume evacuation all of the time when they're using ultrasonics and air powder polishing. There is an attachment that can be used that is more ergonomically correct for those of us who use high volume evacuation on a regular basis?
I use Cordy's, the bracelet.
Yes.
And that is pretty much what solved all of my struggles with it. I've joked on the podcast before, I was like slapping my patient in the face with the tubing. I felt like it was like this boa constrictor that I had to like wrap around my shoulder and like, let me get in there and do it. And which made me not want to do it because it was so difficult, but still knowing that it was the right thing to do to manage the aerosols and spatter and spray. But to be a veteran clinician and start to incorporate the high volume evacuation as we are all being asked to do now for COVID, I think we're going to hear a little bit more concerns around wrist and that left shoulder or whatever shoulder or hand they're using for the high volume evacuation. Do you predict that, or am I?
Yes. No, I definitely agree with you, especially if you're not used to using the high volume evacuation. It is hard. It takes a lot of practice.
It does.
To determine where to sit, how to hold the high volume evacuation, because yes, if you're not used to it, that can definitely impact how your body feels.
So anyone listening to this, if you're incorporating the HVAC, just know we have all struggled with it if you did not learn as a student with it, but you can get it right. Just find the right one and also keep up with your good ergonomics and stretching and strength training, because it's not going to be easy. It's not. Moving into fascia. Tracy, what the heck is fascia?
Fascia is fascinating. I made that up myself. What is fascia? So back when we were in general education, probably anatomy class, some of us were lucky enough to dissect cadavers. At my school, we were able to dissect a cat, which I don't think is allowed any longer. That's how long it's been.
I got the pigs. I got the little fetal pigs.
Okay. So, we were trying to find the bones and the muscles and the insertions and origins and all of that. We were cutting through this fibrous kind of tissue and taking it out and probably throwing it in the trash. And that's the fascia. It's the stuff, if you're a poultry eater, you know, the stuff that when you're peeling the skin off of the poultry, there's this thin layer of connective tissue. That's fascia. And it's been studied, I think, probably more in the last 10 years than ever. And they're discovering that it's really important. They're considering it to be another organ.
Yes. Another communication system almost within the body, right?
Absolutely. Yeah. So it is collagen. It's a fibrous tissue, but it's not just so fibrous as it is kind of gooey. And it connects the top of the head to the bottom of the foot. It innervates in between muscle fibers, and it helps to hold our organs in place. So, you know, your heart doesn't fall down into your hip. It kind of suspends your heart in the middle of your body. And it stretches as we move our muscles. It stretches and then it goes back, and it helps to slide things over. Like if you put your hand on your opposite hand and kind of roll your skin around, your skin can move, but it doesn't slide off your body. It's just moving a little bit because of this fascia that's sliding on top of each other in kind of layers. That's really what fascia is. And the reason I got interested in it is I have a friend who had a hip replacement. And it was obvious after the surgery that one leg appeared longer than the other, like by a couple of inches. I mean, it wasn't small. And so in talking to the doctors, they were firm in saying, no, the legs are the same length. It's his hips are off. His hips have what's called pelvic obliquity. And one hip is higher than the other, making that leg look shorter than the other one. So I started researching this for my friend and realizing, and the deeper I got into researching hip obliquity and kind of comparing it to how we sit in the dental hygiene chair, and we're probably doing this to ourselves, fascia kept coming up in the research and in the videos that I was watching. So that's kind of how I got interested in it. And it's necessary through movement that we keep our fascia healthy. There's no other way to keep it healthy. We got to stay hydrated. We have to eat healthy foods that have all the amino acids and vitamins that are necessary for good health. But we also have to move, or else it will become sticky and it won't have that elasticity that we need. And we see that in hygiene. We as a society, back in the Little House on the Prairie days, I think of that. They had to walk to the general store. They had to hoe their fields and move bales of hay. And everything they did was very, very physical, chopping down all the weeds in their field. But then the industry age came, and we had an industrial movement where we made machinery to take care of that for us. And that kind of started to limit our movement. And then you take it to present day where we have our cell phones, we sit behind a computer, and dental hygiene actually was before the cell phone. And we were sitting static in the dental hygiene chair for, largely the whole day after day after day, and limiting our movement. And so the body aches and pains that we feel largely is because we're static and we're not moving that fascia to help keep our body healthy. See, way that I can help to demonstrate this for your listeners, Michelle, is if they could sit in a chair and move their back away from the backrest and sit tall on their sit bones. Okay. Get nice and comfy on
I'm doing it. Yep.
Equal pressure on your sit bones. And then move that pelvis anteriorly. So you're going to feel an arch in your lower back, moving that pelvic bone forward. And you can feel the tightening across your lower back there. Now do the opposite. Move the pelvic bone posteriorly. So you're kind of sitting heavy on your tailbone. All right. And in doing so, what happened to your shoulders?
They hunched forward.
Your shoulders hunched forward, right?
Yeah.
And what about your neck?
I guess it went forward. They go forward?
It went forward.
Yeah. Yeah.
Yeah. So your neck is forward now. Your shoulders are kind of hunched or rounded over. Now our head is kind of in space, being held there by the muscles, and everything has to tense up in order for us to maintain this poor posture is what it is. But this is what we have to do. And so you're tensing all these muscles up, and as a hygienist, we are in that position for most of our day.
So true. Yeah.
Yeah. So now get back onto your sit bones. Okay. And get to a place where you're almost balancing your head without having to contract any muscles at all. And you'll find that neutral place where you're comfortable and you have very little exertion to keep yourself there. This is what we should, ergonomically, really should be in this neutral position to not tax our fascia and not tax our muscles during patient care. Okay, now going back to our hygiene, raise your arms as if you're holding a mirror and explore over your patient, okay? And feel where your muscles contracted to hold those arms out at the, 90-degree-ish angle, right? So now we have some tensing in the upper shoulder, maybe across the back. All right, now get into the position where you know that you treat your patient. And for me, I turn a little bit, turn to face my patient. So now my torso's twisted a little, and I definitely am heavier on that right hip. Definitely heavier on that right hip. So I'm definitely heavier on that right hip. Now what is happening is we're shortening that right side. So the distance from the shoulder on the right to the hip on the right is shorter distance than the left side. And doing this all day long, day after day in hygiene, we are training our fascia to be constricted on that right side. So then when you come back in neutral position, that fascia is short and it's bringing your hip up higher on that right side, creating that pelvic obliquity.
Can I share what I learned about fascia regarding the constriction? It made me think of that. So the person who taught me about fascia, her name is Ashley Black. She's a person. Have you ever heard of her? Ashley Black?
I have not.
She created this device called the Fascia Blaster, and it became famous because a Victoria's Secret model started using it and found that it got rid of cellulite because it kind of broke apart the fascia that was very fibrous because of adhesions and things like that. And it flattened and smoothed out the skin and got rid of that puckering that was pulling down and giving that appearance of cellulite. So that's where it got its like claim to fame. But she started doing it post trauma from her. She almost lost her leg and life to a hip replacement with flesh-eating like bacteria after the surgery. So it was
oh my goodness,
horrible. So she's got a ton of like fascia and scar tissue and adhesions. But then she started working with like NFL players and actually Olympians and MLB players. And the one that always I remember is the pitcher, the MLB pitcher, and how much scar tissue and adhesions more than anything he had in his shoulder. And what they were explaining to me, or in this video explaining to the world and about this, is that the fascia, as you mentioned earlier, is an organ and has like this communication system, and it's more of your protection in a lot of ways. So it's going to tighten up, it's going to cinch up when it's being overworked or overused to protect the muscle, to protect the joint. So you aren't having these like permanent, like you're not dislocating your shoulder. You're not going to pull like the tendon from like, let's say the bicep head or something like that. Like your fascia is going to tense up first and protect you. But because of that, by the time you feel a lot of pain and discomfort or even have an injury, you have very constricted fascia. Does that make sense?
Absolutely.
So that's why I was like, these injuries, to reverse them, it's a lot of work and a lot of effort, because we, like you said, we have been shoulders up high, constricted, and that muscle's been shortened over time. Based on the fascia. But I'm a big fan.
There's a therapy out there called active release techniques.
I have had it.
Have you had it?
Oh yeah. ART, Graston and ART is my thing. I love it. And not many people do it though. Would you agree? It's hard to find those people.
It's hard to find them, but they are out there, and you can find them on the internet. It's patent therapy. So people are trained to do this. Physical therapists are actually trained in the art techniques. But it's designed to help release these adhesions. And the therapist, well, you can explain it better than I can, since you've actually had it done.
She uses these tools that will feel for these adhesions, and essentially she's rubbing. Now, and I actually might even be confusing Graston and ART, because mine did a combo of it, but she would find these areas that were either not moving, maybe one shoulder wasn't moving in the way that it should, or she could feel these areas that were had adhesions, fascia adhesions, and she would roll this metal thing across it, and she could feel it, and it would get super red and bruise. But basically, because we're bringing blood to that area and it was breaking up adhesions. And from what I understand about fascia is that when it becomes constricted and fibrous, it can trap little veins and vessels and things like that within it. So when you do go break it up a little bit, it does kind of bust those vessels a little bit. But also in the flip side of that, because it sounds horrible, like you're bruising yourself and it looks painful, is actually healing at the same time.
Right, exactly. Because when they do break up that fibrous fascia and those adhesions start to, the fascia separates again, those entrapped nerves are released and the entrapped blood vessels are also released. And now you have better blood flow through the area and the nerves are not being pinched and triggered consistently. Very effective technique. And they move your body. So once they put the pressure with the instrument on the area that they have designated as the trouble area, they move your muscle to rub against. That's the active part of the therapy.
Because it stands, again, active release techniques, right? Not a traumatic restorative therapy, guys. We all know art by ART. But yeah, it is a fantastic, I almost get like immediate relief. But if she does it on my neck, it looks like I had a hickey.
Oh my gosh.
Yeah, because it will, and it's not like I wouldn't call it like a bruise, like somebody like you Charlie Horse, like you punched your muscle or something. You got that like very deep, dark, bluish bruise, but it is like more petechiae, I guess I would say, on the skin. It becomes a little red, and I mean, it's gone by the next day typically, but if you are going out afterwards, it does have a very indicative appearance to it, especially if you're doing it in the neck region, which many of us do need it in that region.
Right. Right. Well, you had a specific area where she treated you in your neck, and where was the pain on your body? Was it also in the neck that she was?
Neck and shoulders, very typically. She's also done my forearms quite a bit, just from the nature of the beast with us. Mine was definitely in my neck. And what we ultimately decided, and this was years ago when I was practicing full time, that I was always having pain on the left side. And so automatically I would stretch the left, like that's the hurt side. So I want to stretch it and I want to move it. And that was actually becoming overstretched. And my right side was becoming shortened and constricted, as you mentioned. And I actually needed to stretch the right side to kind of counterbalance, and then do more strength training on like the left trap, neck, scapular, like back area to kind of counterbalance what was happening in my body. And I was like, well, that doesn't feel intuitive. I was like, the left side hurts. I want to do the left side. But she would always do a little bit more work on the right side, which was always interesting to me.
Mm-hmm. Well, and that kind of falls in line with this massage therapist. His name's Tom Myers, and he's really dug into fascia and movement and spent probably close to a decade reading this. He's published a book called Anatomy Trains, and I found it really fascinating the way he describes fascia and movement as kind of one synergistic need for us people who are learning to sit static for our lives. He discovered as a massage therapist that people might have pain, such as yourself, on the left side, but he discovered that it was the right side that needed the release. And he came up with this book, Anatomy Trains, meaning that there's these lines across our body where these lines link active spots that maybe you have fascia, plantar fasciitis on the bottom of your foot. Okay. And you feel that there. However, that could be caused because something is going on with your hips. And so the tension in your hips is causing the fascia to tug on all the way down from the hips to the bottom of the foot, causing that plantar fasciitis.
Mm-hmm.
So very interesting. And with us, when we are, sitting heavy on our right hip, there's a line that he's discovered that comes up from the back of the right foot, up the calf to the hip, and then it crosses over to the left hip, and it comes around the front of the left rib cage, this line. And so as we're twisting our body and putting more weight on that right hip, we could have pain anywhere along that line that kind of spirals around our body.
Mm-hmm.
I just find that very, very, very fascinating. And it makes sense. My pain from hygiene is I'm putting all this weight on my right hip and I get a lot of pain on my left scapula. It makes some sense.
Definitely does.
Mm-hmm.
Are you familiar with Rolfing?
I've heard of it, but I have not researched it at all. Not at all. No.
I've had it. It's amazing, but also feels like pseudoscience. Like at first, like if you're like, especially if you're like very used to getting massages and like them really digging in, getting that trigger point, and the science is more around fascia, like releasing these big, like your hips and feet. And it's not always comfortable, and it's definitely not cheap. I'll tell you that. But it is fascinating that what they're doing by just putting a little pressure to release and move it's more of like, let's say for the hips, for instance, like you lay on your side and they're going to grab like your hip bone and kind of pull and work with it and make the hip release itself. So it's mobile because even though we're all connected body parts, like you should be able to lift my arm up and down and not see the left shoulder move. Right. But like if you're starting to like move that right arm and you see that left kind of like countering it, like that's the adhesions, and the fascia has become very bound. And so it's about like breaking up these, what's the word I want to, like you're saying that like cross-body fascia, and it's like a system, but it's allowing it to become independent systems again versus this one like bound body part that we're like, you shouldn't move my finger and my elbow wants to move with it, you know,
right.
Very independent moving body parts. It was really fascinating to get that. But again, it was not hard, but it did get rid of my plantar fasciitis, and mine ended up being in my knees.
Interesting. Well, I think of, you know, as you're talking about this independent movement, and it's really because it becomes dependent because of these adhesions and the fascia becoming sticky and gluey and not very mobile. I picture, remember the morph suits about 10 years ago, or like Spider-Man wears a unit type suit that covers his entire body. Okay. So that would be like an external visual of what fascia is, from the foot to the top of the head. And sitting in your chairs right now, if you were to grab your t-shirt at your rib cage and scrunch it up really tight, you can feel that fascia or your scrunched up t-shirt is pulling down on your shoulder. It's pulling across the entire back. And you might even feel that bound up fascia pulling on the opposite shoulder. And that's kind of a good visual of how this fascia works around our body too.
That's a good visual. And there is actually a YouTube video out there that this physical therapist does just that to a man, and kind of like bunches up pieces of his clothing and is like, now lift your arm. And then you can see how, like what's happening. It's a great YouTube. If you're having a hard time visualizing what that looks like, definitely go check that out. Is there any other things that we can be doing to help our fascia outside of like ART or rolfing? And stretching, of course, but is there any
stretching?
Else?
Yeah.
Mm-hmm.
Well, absolutely. Stay hydrated. You know, we need this stuff to be very gooey and liquidy. So staying hydrated, I think, would be top of the list for me. And then also the yoga and practicing proper ergonomics and just really focusing on it, being aware of your body's position as you're performing your hygiene therapy, and start to slowly correct the imbalance in your hips or the imbalance in your shoulders. And, if you've been practicing hygiene for a decade or 2 decades, it's taken you a long time to get into this malpractice and poor ergonomic state. So give yourself the same amount of time to start to correct these issues too.
One of my issues when I was trying to correct a lot of my pains was feeling more pain.
Like that overcompensating?
Well, mostly that I was now working other things that had not been worked. And it was like going to the gym for the first time again, like after a little hiatus, and my other parts of my body were like, oh, wait a second. We relax during this time. What are you doing? So is that a common thing that you see when you're like maybe training people with ergonomics or trying to get them to sit or stand or function in a different way?
Well, I would imagine, this is more of an Aubreé question because she does, train people in yoga and proper ergonomics. But I would imagine if you've had weakened muscles on the left side of our body, that as you start to train them to become more ergonomically correct, that they are going to, have some, they're going to want to talk to us a little bit. But I don't know, Aubreé, what do you think about that compensation?
Yes, I agree. Most of, what I'm teaching starts while the students are in school. So for me, I'm training the students to get into good habits now so that they can take those habits with them and continue in private practice. I personally haven't worked one-on-one with hygienists that are in private practice, with the exception of teaching them yoga to help reduce their pain. But for me, I want my students or our students to have good habits that they can take with them so that they can have long careers. I feel that's most important.
So good. And such a good point. As we're wrapping up, are there any little points or tricks or tips that you have, maybe even for a student and also a veteran hygienist? Because we do have both listening in.
I think incorporating simple stretches in between patients doing simple neck stretches where you're moving your right ear to your right shoulder, holding for a few seconds, moving your left ear to your left shoulder, holding for a few seconds, doing some simple shoulder rolls. Anything that you can do in between patients, I feel would help. And once again, me with personal experience, if you haven't tried yoga, there are so many benefits to practicing yoga, not only to help reduce pain, but also mentally reducing stress, making you more aware of your body. There are so many benefits.
It's good advice. Anything from you, Tracy?
I think that incorporating anything that you like to do, as far as movement, and it doesn't have to be, doesn't have to be so exerting that your heart rate goes up to 180 and that you're sweating. The movement can be slow and peaceful. Any movement is muscle movement. Any movement is fascia movement. So it can be nice and slow, peaceful, kind of help to reduce your stress, maybe 5 minutes, in the morning, and then 5 minutes before you go to bed at night. It'll make for better restful sleep also. Yeah. I think people, they think about exercise and they think they have to dedicate an hour to it. And then they're sweaty and then they have to go home and take a shower. And so now this becomes a half a day issue. And that's just not the case. You don't have to break a sweat in order to get the benefits of muscle movement.
That's so true. Uche Odiatu has been on the podcast quite a few times, and he always talks about like these, movements before you get out of the bed, just, a few minutes at some point throughout the day, just take a few minutes and maybe do get your heart rate up just a little bit, maybe do some jumping jacks at lunch. Then mixed with the slow, simple stretches, just get yourself moving. And it doesn't have to be hour aerobics class where
Exactly.
and then you feel guilty because you didn't do it. It's something is better than nothing throughout the day.
Absolutely.
Well, I would love for you guys to tell our audience where they can even read more things that you've written, research, like Aubreé, you have that research. And if they have any questions, are they welcome to reach out to you, and how did they do that?
Yes, you can contact me through my personal email, which is yoga4dental@gmail.com. And you can also check out my website, which is yoga4dental. And all of my information is listed there. I have all of my publications listed. So please feel free to reach out to me. I'm more than happy to answer questions and give you advice.
Excellent.
And then I would probably be best reached by my work email, which is TRR, there's 2 R's, OSS for Tracy Ross at westcoastuniversity.edu.
That's perfect. Well, thank you, ladies, so much for joining us and giving us your expertise and knowledge so that we can be healthier clinicians for the long haul of our great careers in this wonderful profession of ours. So thank you so much.
Yeah, thank you.
Thank you for having us.
Andrew, are you going to start doing yoga ever?
Funny enough, we actually just talked about this, and no is the answer that we came up with.
Who's we?
Chelsea and Allison and I, we went to dinner a little while ago, and I'm like, maybe I'll start doing this. And then, no, maybe I won't.
I love yoga. I don't love yoga, regular yoga. I don't know. I like lifting weights, but I love yin restorative yoga, which is just like a lot of stretching and holding those stretches for a really long time. That's my favorite.
I feel like yoga is a thing that I would do socially. I'd be a social yoga person. Like if I had a bunch of friends that were going to be doing it, I'd be like, I could go do it. But I feel like the same thing for mountain biking. Like I probably wouldn't go get a mountain bike and put it out, on the rack of my car and then just go drive and do it by myself. But then if my friends were going to go do it, I'm like, oh yeah, sure. I would go do that.
That's interesting because I feel like guys especially would not do yoga with friends until they were able. If you were going
to do it though, is when none of us can do it. And so we can all bust each other's, humps a little bit about that kind of stuff. So,
okay. I will say yoga definitely helped with my pain management when I was seeing patients full time. I'll also say cycling did, like going to spin class. which is, I know you're
Look,
like,
I would
know what you're talking about, but I think it was a core stand it was like better. It was good for my core. And because of that, I was not in as much pain. I also identified that I have very short quads because I sit, and as I'm sure all of us do, that sit multiple hours a day. And so when I started stretching my quads better, that really relieved a lot of the pain in my back that I thought was my hamstrings. It was not.
Well, I mean, for all of our listeners that have actually never seen me, I have an 8-pack already. So it's like, you just I don't really need, I don't think, the spin class.
You have an 8.
I have the one, that extra one for those really in shape people.
The V.
Like, that's what we do. It's just like, and then cut, like,
tell Molly the Disney watch party that we're going to have is Pinocchio, and we're going to start there.
Okay. Look.
Because her dad's a big fat liar.
Look. That's good, actually. That was really good. I see how you looped everything into all of the things. I liked it.
You see?
That was good.
Sometimes I'm
so
a
smart
on this
You're
podcast.
so smart.
Smart ass is actually what you meant to say, but
no, I don't say bad words.
Okay, I said it for you.
Thank you.
Well, you can go look on our Instagram and see some lovely pictures. You know what just popped up on my time hop the other day?
Wait.
We were
Amsterdam?
No.
Oh, ADHA. What? Like, what happened?
It was ADHA.
Okay.
It was ADHA when we were in Kentucky and we were doing those the videos for our website, and we had all the bloopers. So if you want to go see Andrew and I and some bloopers, check out our old Instagram.
Don't
TV
bother
stuff.
anyone. Don't go see any of our stuff.
Funny.
It's not
so
funny.
Which leads me to remind you guys, you can find us on all those social media platforms, on Instagram, Facebook. We're on LinkedIn as well. And if you would like to, you can subscribe to our newsletter by going to taleoftwohygienists.com and just clicking that subscribe button, where we send out about a weekly newsletter, some tidbits, recaps. Anytime we have really cool information or deals or something, we're going to send them out to you there. And so just go to taleoftwohygienists.com, and we would love if you rated and reviewed us, especially on Apple Podcasts, because apparently that matters.
It does.
And we would love that. And in our show notes, you can actually click a link that will take you to just about any of the podcasting apps, right? To do that?
Yep. That's a pretty easy
awesome
click, and then write a review.
And don't forget to subscribe to the many other podcasts that we have under the network, which is the Dental Podcast Network, Channel 1 and Channel 2. We have Mom Dentist. We have the Dental-ish podcast.
Very excited about that new one.
We have that new one. I'm personally excited about my new one with India, which is the Level Up Infection Prevention podcast. What else am I forgetting? What else is in that network?
Oh, you put me on the spot. I can't think. I think we hit them all. No, we did. The ADHA and the OSAP have their own individual spinoff ones, but they did come from Channel 1 and Channel 2.
Awesome. So you got dental podcasts for days, and we would love for you to rate and review any and all of those. We appreciate you guys. We hope you have a great week. Stay cool. Don't get headaches. Stretch your body. Take care of yourself so you can keep taking care of your family and your patients. Y'all are the best. Have a great week.
Have a great week, everyone. Bye.
Bye, y'all.